Okay, so my name is Rafi Tanikian. I'm from Biogen IDEC. I work in the protein engineering department there. And Biogen IDEC does have a bispecific platform, but as we'll come to see today, there are many, many different bispecific platforms. And I think the take-home message, if I could kind of convey the take-home message from the very beginning of this talk, is that whatever platform you decide to pursue in terms of a bispecific should be dictated by the biological outcome, the mode of action that you are interested in. So although there's many bispecifics out there and many different formats that we could use, it's really important to remember that you have to tailor the bispecific to the type of to the type of biology that you're actually pursuing. So what is the state of the art? So as we all know, obviously, since you're attending the PEGS conference, which is a great conference, that antibody-based therapeutics have seen much success these last few years in the clinic, and there are probably slightly more antibodies that are entering clinical trials every year. So the number is increasing, and the number of approvals are also increasing. So right now, I think it's about 50-50 small molecule and antibodies, which is very encouraging. 20 years ago, that was not the case. It was all small molecules. So bispecifics, and just as a very loose definition, I would say, of bispecifics, there are antibodies that bind, or antibody fragments, as we'll come to see, that bind to two antigens simultaneously. And why they're promising? Because they could, for example, one advantage would be, imagine if you're targeting a receptor on a cancer cell, and then that cancer cell kind of evades the therapy, escapes therapy, an escape kind of mechanism. If you have a bispecific that targets that one receptor, but also another receptor, it could actually keep the cancer cell from evading your therapeutic. So that's a big advantage of a bispecific or over just a regular Ig monoclonal antibody. And by having a bispecific platform, what we could do is also increase tumor targeting by virtue of avidity. So imagine if you have one receptor you're interested in, if you have a bispecific that actually is bivalent, it could target that epitope or multiple epitopes on that one receptor, thus creating some avidity and increasing the potency or the efficacy of the molecule. You could also modify it and then have cytotoxic agents such as antibody-drug conjugates or cell-based targeting, as we'll come to see with some of the immune modulators. So that's also an advantage that bispecifics bring to the table that classical just Ig-based monoclonal antibodies do not have. And because they still have an Fc, what they could also lead to is increase in cytotoxicity because they could actually recruit either the innate immune cells or the adaptive immune cells, as we'll come to see with some of the technology from Micromed. And because they're so efficacious, you could actually dose at a lower level. So that's also very important. So you could decrease your cost, obviously. It's better for the patient. And because you're working with a bispecific, like I said, working with a lower effective dose is always better than working with a higher dose. But there are challenges in the bispecific area. So